need to continue to bring these resources and support to caregivers is even more important now during this pandemic and time of need. So we hope you enjoy today. We hope you find it helpful. And I would encourage you to spread the word. And if you want to attend again where it's more interactive next month, please do. We will be sending out an invitation to all of those who participated this time as well. Excuse me. Stephanie, would you like to introduce yourself as well?
Thanks, Carol. Yes, my name is Stefani Wilson, and I'm a family consultant with Del Oro Caregiver Resource Center, and I provide supportive services to family caregivers who are caring for someone at home that's a frail elder or someone with a brain impairment. And Carol and I have teamed up. We've been doing this workshop and today a presentation for a number of years now because we understand the challenges that family caregivers face while caring for someone in the home, and as things get more challenging. We've been continuing to provide our services during this pandemic from our respective agencies, and we've witnessed the impact of the COVID pandemic on our clients who are just kind of navigating the day-to-day challenges, but also wondering, what is entailed with considering a transition to a care home. So I'm happy to be here today.
Thank you, Stephanie. And I just really want to thank Del Oro, the Alzheimer's Association. We have partnered on several events, and it's really all new to us too. This virtual trend of Zoom presentations, and we can't meet face-to-face with folks right now, so we miss that, but we're doing the best we can, and this isn't a perfect venue, so bear with us if we make a few glitches, have a few glitches or problems along the way. So anyway, we welcome you again. We're going to get started. We're going to have a Q&A, a question and answer session at the end of our presentation. So you will be able to send your questions into the chat. If you have any technical problems, please also put that in the chat room, because Simone from Del Oro is handling that in the background. And we appreciate your participation, and we'll do the best to support you through this. Simone's done many of these, so she'll be able to direct you through any problems you might be having. So anyway, let's get going, and we've got a lot to share today. Our goal, okay, here we go. Come on, let's go. Our first glitch, there we go. Our goal today and what we're going to be discussing with you is, how do you know when it's time to consider a care home? And that includes the challenges you're going to be experiencing emotionally, the stress levels, and then we're throwing in bits and pieces in regards to what the pandemic has presented and the changes we've seen. Listening to the whispers of your heart and mind, and this is Stephanie's piece that she's so good at, revisiting your care plan, communication strategies and the reason to start planning now, the nuts and bolts of exploring care home options. That's where I really dive into the piece that will really help you stay organized and make you feel like you're prepared for the crisis potentially, or have a plan that you could initiate when you need it. And the plan is going to be different for everybody. Everybody on this workshop today is going to have a different journey. Everybody will take different pieces of this away of what we're presenting. We're going to talk about the changes in the senior care settings due to COVID-19. And lastly, but one of the most important things, is learning to be a partner in care with realistic expectations, whether you're setting up home care for the first time or whether you're looking at a transition out of the home. Being a partner in care is critical, and having realistic expectations in today's time, the pandemic, even more important because it's a stressful time for everybody. So Stephanie, why don't you take it away?
All right, thanks, Carol. So as I talk with family caregivers by phone during this pandemic, One of the things that I'm hearing oftentimes is many of the changes, not that we're experiencing just during COVID, but also changes that are happening for their loved ones. And, Alzheimer's disease, Parkinson's, the progression does not stop because we're in a pandemic. And so those challenges, in addition to this pandemic that we're in, and especially here in California with the heat wave and the fires and the smoke, it's impacting us. And one of the things that I'm finding with my clients is we're finding that it's not just one thing, but it feels like it's kind of stacking up. And something that I've been hearing, and I was talking with Carol about, is, well, gosh, we have to wait to even think about a care home until after the pandemic. And one of the conversations that I'm having with folks is you don't have to wait necessarily for placement. You don't even have to wait for placement necessarily. And we're going to talk about those things. But one of the things that Carol and I always encourage, whether we're doing this workshop in person or now via Zoom, is to not wait for the crisis, to start thinking about what is happening in our lives, what is contributing to this decision of how much longer can I do this. And so on this slide, what we typically do in our workshop is we encourage folks to pull out, take their pen and do a check mark next to the factors that are influencing you right now. And so if you have a moment and you're a family caregiver today, go ahead and maybe take out a piece of paper and a pen if you haven't printed off these slides, and maybe make a note of what is happening, not just for the person you're caring for, but also for yourself. Because I think one of the things that caregiving often reminds us is we are human. No matter how much we love someone or care about someone or want to be able to keep them at home, it does get more challenging. And it is because we are human. So some self-compassion. And so gently, we'll just kind of walk through these. And I hope, if anything, it affirms for you that you're not alone in the challenges that you are having with caring for your loved one. So if we look at the care receiver side, I think oftentimes when I talk with folks, they do tend to focus on, well, it'll be when my loved one can't recognize me anymore due to the cognitive impairment. It'll be what they need. And so we'll focus on that first, but then what we'll find too is on the caregiver side, it's also factors happening with the caregiver. So we'll walk through these together. One of the top of the list, increased fall risk. I think it's a concern for all of us. And if we're not getting out, if we've got less activity, then fall risk is a concern. Just last week, I was talking with someone and she said, you know what, I feel like I've got the local fire department on speed dial right now. Because her husband is, getting up and moving around and forgetting his walker, or they're in the bathroom. So fall risk is a big concern. Increased personal care. I hear from clients that, I'm not a nurse. I don't know how to do these type of activities, especially if it's wound care, or maybe it's managing diabetes and managing blood sugars. There's all kinds of challenges that do come up. Those care needs increase. Sometimes it's not just the personal care, but the emotional care, the reassurance, responding to questions. Why aren't we going anywhere again today? If we think about the pandemic. Maybe this feeling of walking on eggshells, trying to keep everything okay for now. That emotional care with someone that has a cognitive impairment can be a heavy weight on the family caregiver. Wandering, and I put down leaving home as well, because I talk to a lot of clients. They say, well, they don't wander, but he does try to go to work each day. And so, so with wandering, it may be that they want to leave the house. There's things that can be done to help prevent that, and those are things that we can help with in that care planning aspect in my role as a family consultant. Sundowner syndrome, or day and night confusion. So sometimes if somebody is up in the night, then they sleep during the day, and round we go. And it's 24/7. And it's one thing if it's a day or two, a night or two, but boy, when it's day after day and night after night, it's that, again, that reminder that we're only human, and it does take its toll on us, the importance of sleep. Incontinence and excessive laundry. I have many clients who talk about, the strain on their back, not just due to fall risk and helping their loved one up, but maybe changing the sheets. Maybe it's cleaning the bathroom daily because of, messes that tend to happen. So incontinence, I have a lot of clients that just really get burned out on that round and round. And then finally, aggression and challenging behaviors. Sometimes things can get very challenging. In our workshop, we always, typically have a couple of people that are really concerned, and maybe not themselves, but maybe their adult children are concerned for them. That it can be scary at times, or he gets angry like he didn't used to, or it's harder to calm him down. And so again, it's not maybe just one of these factors, but it's when we start getting more than one that make it more difficult. So if we shift over to the caregiver side, some of these factors with the care receiver do influence the caregiver. The lack of sleep, again, day in and day out, if we're not getting sleep at night, that, we are only human. Limited financial resources, the cost of maintaining a loved one at home, whether it's adult day programs or in-home care, it does add up. And we find, and that's, at Del Oro, we have a waiting list for those respite funds, and we receive funding, luckily, to help with that. But sometimes that's what leads a caregiver to begin thinking about a care home. And Carol will talk about that as well, kind of weighing the costs and benefits. Also, no time for self-care and leisure. This is really difficult, I think, especially during the COVID pandemic. If we're not able to maybe even talk on the phone, or read that library book, because we've got to keep eyes and ears open for our loved one, or not even able to get out and maybe go have coffee. I talked to a woman last week, and she said that her daily exercise was walking to the Starbucks, and that the barista knows her, and they would check in, and she said that's someone that cares. But if we're not able to get out and do those things that typically kind of refilled our cup or recharged our batteries, or just a friendly smile, then that also takes its toll on us. The impact on non-caregiving commitments for working caregivers or family, or even your dreams. I talked to a son, and he was wanting to kind of start his life with his partner, and was caring for his mom, and he really felt a lot of emotions, which we'll get to, with trying to manage that delicate balance of caring for mom and keeping her at home, but at the same time, he was in his mid-30s, and he was really having a desire to move forward in his life too, and his dreams. The impact on relationships. If you're, especially I think in a marriage, if it's a husband, if it's a partnership and they're caring for an aging parent, if we don't have time for each other, or to have conversations. I hear that time and time again from couples who can't even talk about problem solving for the bills, or how are we going to manage our care plan and our next steps if mom or dad is just in the next room, and so it can really contribute to added tension in the relationship. Also, physical health and exhaustion. This is oftentimes what tends to get our attention. Right? We can keep going, and oftentimes our bodies will let us know, whether it's heart challenges, or there are circumstances where maybe a surgery is needed, and we put it off as long as we possibly can, but the doctor says now it's time. And so it does take its toll. And so how do we meet our own needs while caring for someone? And then finally, emotional fatigue and burnout. When someone depends on you, chances are you're focused on what do they need, what do they want, how are they doing? And oftentimes we forget about ourselves, or we just don't have the time or energy to say, how am I doing? What do I need, and what do I want? And over time, that can lead to burnout. Next slide. Oh, go ahead.
I wanted to give you a little input on that. I'm working with a family right now, caring for mom at home, planning for placement. But this last Friday, mom broke a bone. They took her back home thinking they could manage her and set up a little bit of home care. A couple days later, she fell and broke another bone. And, they realized that this level of care, I can't handle it. I've hurt myself. But I can't keep her safe now. I'm so exhausted. So, we see these kind of things on a regular basis. So, it almost seems like to me that caregivers get into this gap where you know, they're in that dangerous zone where they're not getting enough help, but they're still trying to provide care. And we urge them to set up more help before they get into these binds if they can. So anyway.
Thank you, Carol. Yes, and if you find yourself wondering, you know, what do I do next? I can't keep doing this by myself any longer. And the way that we're doing it, you know, that's what we're here for, is to give us a call and we can take a look at, you know, what's working, what's not working, what are those next steps? And because there's many steps between a diagnosis and thinking about a care home. And it's quite the journey. And I think that's one of the things that Carol and I can definitely relate to is the journey does have some wear and tear. It's a bumpy road, and we don't have a crystal ball to see what's going to happen next, but we can kind of listen to the whispers, as I call them, because they do get a little louder and a little louder. One of those is with burnout, and oftentimes we don't realize it. So if you have folks that care about you and are saying, you know, I'm concerned, or it seems like, you know, if they're giving you some observations or expressing some concern for you, in our workshop, we have a caregiver burnout quiz. And oftentimes it's kind of that opportunity to maybe, you know, to check in with ourselves and say, how am I doing? You know, how am I coping with this? And again, there's no judgment here. I think it's just part of the reality of what we're coping with. And so on the left side of this screen, you can see some symptoms, signs and symptoms of caregiver burnout. And so if you recognize those for yourself or someone you care about, you know, definitely have that conversation. Maybe it's talking with the doctor, calling your family consultant at Del Oro, and you know, and sometimes counseling can be helpful, revisiting your care plan, and we're going to talk about some of those things here shortly. One of the things that we wanted to highlight today that's a little different than our typical workshop is how the COVID pandemic has affected caregivers. And Carol, feel free to chime in on this as well, because we've definitely had some conversations about, you know, what this looks like. Last week I talked to at least 3 family caregivers who were working remotely and trying to care for an aging parent and had teenagers at home and going to school remotely. And so they were trying to juggle space and time and attention and Zoom calls and just trying to juggle all of that. And we're 6 months in to this pandemic now. And so it's kind of becoming this new normal of sorts. But for the sandwich generation and trying to meet, you know, children's needs, parents' needs, and then also their own, as well as their employers, it's definitely a lot to juggle right now. Reduced or lack of income due to the pandemic. I talked to a gentleman who's caring for his mom, and he has his own business, which has definitely been affected by COVID. And he said, I've had to reduce our in-home care because I can't afford the in-home care based on what I'm bringing my income now. And so he's trying to, you know, work on, you know, how to adapt his business and also pay for in-home care and trying to, you know, he said, my goal is to get back to where we were, but I just don't know if that's going to happen. And so if we really, you know, hear those stories and listen to ourselves and what we're going through, it's really acknowledging that this is very stressful, that this is, you know, something, you know, it's heavy to carry, and it's very difficult to find those solutions, but it's definitely taking some time and some energy to focus on that. So getting some support is really important right now. One of the other things that I hear often is just trying to prevent a hospital visit or not wanting to go to the doctor. Luckily, you know, many of our medical systems have adapted to video appointments, you know, the advice nurse protocol. And so trying to get access to medical care, but also, you know, preventing falls, like Carol, like that example you gave. It's very difficult to think about, you know, someone that we're caring for going to the emergency room, but also I've had clients tell me, gosh, I hope I don't have to go. What do I do if something happens for me? And so there's kind of just that level of fear or concern about those what ifs that can be very challenging. One of the other things specific to caregivers is the limited respite. Our adult day programs are currently closed. So the person that was attending the programs, they're not getting that engagement, that socialization, that getting out of the house. Like I mentioned earlier, I had a woman, she said, my husband asked me every day, are we going to our place today? And are we going to the library or to school? People have come up with different names for the adult day programs, but what we do know is that it contributes to their quality of life. And that when that piece is missing, it not only affects the person with the cognitive impairment, but it also affects the caregiver. They miss maybe having those folks to check in with. It's someone else on their team that they get feedback from, or just a friendly smile. In-home care, some clients have continued in-home care with in-home care workers that they trust or maybe have a relationship with. Others feel like they need in-home care, but they're concerned. They're concerned about, how do we bring someone in? And so really thinking about one of the things we talk about is, okay, what are your concerns? Talking with the agency about those, talking with the individual that comes into the home. I have one client that she's got a little table set up by the door, and she's got gloves and Clorox wipes and masks and in her protocol, and that's where her requirement. She said, not just for the person that's coming into our home to help with caregiving, but anyone that comes in, family members also. So really thinking about that limited access to in-home care. And again, not just with in-home care workers through an agency, but also maybe family members or neighbors or friends that maybe were helping out before the pandemic, but we're reducing that risk, that exposure right now, because we are working with vulnerable populations. But that definitely affects the family caregiver too, because they're not able to maybe get out and take their walk, or to, or maybe even to attend a Zoom support group, because I facilitate a support group, and oftentimes their loved ones are kind of popping in and saying, who are you talking to, and what's going on, and just not have that privacy even, because that person's not there to kind of occupy their loved one and to be with them. That companionship is so necessary. And so that kind of goes along to the leisure activities and gatherings. All of us, whether we're caregiving or not, have had to reduce those gatherings, and getting together with family or friends, or even that live support group, giving hugs. And and again, I know I say this quite often, but we are human, and we do need that touch, and we do need that companionship. And if we're not able to take a break, to get that respite, that time off from caregiving, it can nag at us. It can affect us. I have some clients that say, I'm more irritable. He's not able to talk with me about what I'm seeing on the news, to talk about strategies, and so just needing that companionship and some interaction with others. So finding ways to connect with folks during this pandemic.
I wanted to say that many of the caregivers that I'm working with are saying that pandemic, things don't feel very different for them. If they haven't got support services in place in their home, caregiving 24/7, without a caregiver, without daycare, they don't feel like life has changed that much because they're home all the time. But that's where you're even more at risk. You more need to get more resources wrapped around you when the time's right, and when we can do things smartly. But I hear that quite a bit, where my life hasn't changed that much. And it's like, okay, it just goes to show you, So I'm going to move to the next slide for you, Steph.
Thank you. Yeah, and I think that's what's so important to remember, is this is not a one size fits all. Right. And, I read this kind of a meme or a quote the other day, and it said, we're not all in the same boat, but we are in the same storm. Yeah. And how that affects us can be different, or how we're feeling in the moment. I kind of think too, we each kind of have our own COVID philosophy, is how I've come to describe it with talking with clients, and that increased sensitivity of how do we communicate what we want and need during these times. So as we think about, all the reasons that lead us to anticipate a transition to a care home, or even to maybe start exploring options, and especially during this pandemic, it's really important that we pay attention to the thoughts and beliefs that run through our minds. I call it mind chatter. And I think one of the things that I've learned in my role as family consultant and counseling family caregivers is that these are often the things we don't say out loud, but they do roll around, and they oftentimes may keep us from even taking the first step of having the conversation, of exploring what would it look like if. And so I just want to acknowledge with this slide what does come up. And we put together this slide from the work that we do with family caregivers, as well as in our support group. The Kleenex tissues get passed around, and knowing nods and smiles, and even some humor happens, because we definitely try to give that feeling that you're not alone. So I hope that this slide helps those of you that are joining us today to understand that as well. So oftentimes when we start thinking about a care home, we think that we're letting someone down. The promises we've made. I promised my mom I would never put her in a care home. And luckily, care homes have changed over time. And so hopefully that kind of helps us with those beliefs. Because really we want to find someone that does also care for this person that we're caring for in our family. I'm selfish for wanting my freedom to live my life. I had a couple that were caring for his mom, and they said, we feel so selfish for even wanting our freedom. But we're in our 70s now, and we feel like we only have 10 years left in our health to travel or to visit our grandkids and those type of things. So again, kind of those beliefs that are rolling around. So as we're kind of walking through this, I encourage you, if you've still got your pen and paper handy, maybe write down what does come up for you in your mind or in your heart when you think about when you think about even thinking about a care home for your loved one, because this is part of the journey and kind of crossing over that bridge when the time comes. I'm not as strong as I thought, or I'm not as caring as I thought. Kind of insert your own word there. I've been doing this so long. What's next? I have folks that, I have a gentleman that said, this was my job, and I feel like I'm going to be put out of a job because I've been caring for her so long. And he was enjoying it, but it was getting to where the care needs and the dementia progressing were determining the decision. And so he was wondering, what am I going to do next? What does life look like? And so it's really important, if we acknowledge that, then we can maybe think about, okay, what does life look like? If I'm not doing this 24/7, I'll have more room on my plate for maybe some things that I enjoy. Also, I'm scared of what I've heard, especially during the pandemic. And Carol will talk a little bit about that because we have seen the news. We do know the realities of the exposure to the COVID pandemic. So it's okay to acknowledge that we may feel scared of what might happen. Those what ifs can sure get us. And then finally, I don't know how much longer I can do this. And I think that's the one that probably runs beneath, I would say 90% of the clients that I talk with about this next step. And I say, you know what, let's just start talking about it. Let's just plant that seed. And because we don't know how much longer. Sometimes it's not just up to us. We mentioned the physical health piece. And I do have a number of situations that we don't want to wait for the crisis. It's okay to put things in place for the someday plan. Is one of the ways that we like to put it. So as we think about the thoughts and beliefs that run through our minds, the emotions also come up, and it can be like a roller coaster because each day can be different also when we're caregiving. But if we fold in that we're caregiving during a pandemic, there's even more, the emotions, I think it's almost like a dial, and it's turned up even more. Our sensitivities are turned up, our vulnerabilities as well. And so when we think about the emotional roller coaster, there's grief and loss. There's sadness. We may feel helpless or even hopeless. What do we do? We may feel like a failure, to maybe not feel like enough, or I should have done more. Anxiety and worry. Those fears of, what's going to happen. I talk with a lot of clients about, gosh, what if I bring somebody in to help me out? What does that look like? What if I do start looking at a care home? How do I know that they're safe? How do I visit? And again, Carol will talk about those things. That uncertainty, feeling irritable or angry. I don't like who I see in the mirror. I don't recognize myself anymore. I hear that a lot because, again, it does affect us. And then fear and guilt. And it doesn't have to be just one, right? And one day we might be feeling a little better, and then the next day we may be really missing our companion, our husband, that maybe isn't himself anymore. He doesn't recognize us anymore, which can weigh heavy on the heart. So when we have all of this rolling around, it can be very overwhelming. And so I just invite each of us to take a breath, because the next step is to revisit our caregiver action plan. What are our next steps? How do we approach this? And so I'm hoping today, from the conversation we've had so far, is that you're recognizing the impact of the pandemic, as well as the increasing care needs of your loved one. With a cognitive impairment, oftentimes they are progressive diseases. They do change over time, and it's really important to recognize that. And even like the limitations, if we're not able to access adult day programs, and our loved ones becoming more restless or agitated at home, how do we cope with that? I actually had a client where she went through the care home process in April. And she said, I thought I was really just letting everybody down, but I was trying to work. I had kids at home, and mom was yelling at the neighbors, and I couldn't keep up with it all. And she said that mom is actually doing better now. She has activities. She's got people that check in with her each day, and has become home for her now. And it's not an easy process, but it can be done. And so I think recognizing the impact of what's happening is really important, because it helps us at this point in the transition, but it also helps us afterwards. Like with the client I described, we talked about what was life like beforehand, and then what is life like now. And she was able to see, okay, it is actually better for all of us. I can focus on work. I can help the kids with their remote school. And I know mom is being well cared for, and we visit through the window. So that's the first step, is recognizing the impact and what the care needs are. Second is communicating those challenges with your support team to explore the medical and behavioral interventions. So staying in communication with the doctor. Many of us can email or communicate electronically with our doctor. And so letting them know, here's what's happening right now, just so that they have a heads up, because there is paperwork that primary care physicians need to complete in this process. So again, Carol's going to talk about those steps to be prepared for when the time comes. In the meantime, revisit your care plan. Maybe think about, what are some of the respite care options? What do you need right now? I talked to one woman, and she said she hadn't been to the doctor and had her own health concerns. So we talked about, okay, who could come in and stay with mom while she goes to the doctor and has her blood work done and things like that. Attending online support groups, workshops like you're here today, and educational events to gather information and support. Again, to not be so isolated, to find ways to connect via Zoom, or to connect by phone, or even waving at neighbors across the street. There's a number of ways of getting support right now during this pandemic. And then, like you heard today, gather information about the placement process, so you know what steps are needed. This isn't a one-step process. There's several different steps, and especially it's a benefit for you and your loved one if you take those steps in your own time versus waiting for a crisis. So we definitely encourage that. And then finally, keeping family members informed of the challenges you're experiencing and the next steps you're exploring. And that's really important, because one, none of us like surprises, but two, it's keeping people on your team. So thinking about, who can support you with this process, who understands what you're going through, not just what was happening 6 months ago, but how the pandemic is affecting your care situation today. Because by gathering this information, you can even tell them, I attended this workshop, I made this checklist, here's what my loved one's going, here's what our loved one's going through, here's what I'm going through, here's what my doctor says. Sometimes the doctor can be a great advocate for what you need, especially physically and emotionally. But keeping people informed, so that when you start looking at the process, they have that understanding, which is something that we really value right now during the pandemic, is understanding via communication. Carol, do you mind going to the next slide, and it gives us some examples?
And I would like to mention too, sometimes if the relationships aren't good in the family, it's sometimes not comfortable keeping other family members informed. Mm-hmm. But I urge people to try to figure out some way of doing that, so you're not adding fuel to the fire and making things harder on yourself. We particularly see that sometimes in situation in a blended family, where his kids and her children maybe don't agree, and And ultimately, the power of attorney, the spouse, is making decisions that are best for them as a caregiver, so, and a care receiver. So, you know, keeping people informed is really important, even if it's just via email or text, just to let them know, and not springing anything on family members to make it harder for yourself.
Thank you, Carol. So important. And I think I find, like you said, like in blended families, or even with parents trying to communicate to adult children, you know, I've done this as long as I can. And one of the things that Carol and I always talk about in our workshops is, where is that line for you? And it's a very personal decision, or your own personal situation, and not everyone will understand. So finding ways of how do we communicate that, and email can be an excellent way to communicate with folks, so that it's not so emotional for everyone, but gives everybody a chance to kind of read it, digest it, and then maybe having a conversation about it. This slide we put in, it's just a helpful tool for those that, you know, if you have a situation where someone's really encouraging you to consider a care home, but you're not quite ready. There's some strategies of, you know, I'm not quite ready, but I appreciate your concern. And then maybe it's an opportunity to say, I could use some help with this. Right? So I could use some help with paying for in-home care, or I could use some help with you're coming over so I can go to the doctor and get something checked out. So it can be a great way to, you know, hear their concern or the opportunity for communication, and here's what would be helpful for me. Some may discourage you from even thinking about it, and that's where we really, it's so important to, you know, have our list of the whys, you know, what's leading us to this decision, to even even look at and kind of process your, you know, the beliefs that are coming up for you, because those will definitely be challenged if you do receive some feedback from folks that are discouraging you. But essentially giving, you know, finding ways to communicate. Oftentimes I'll talk with clients about, you know, it's okay to write it on an index card. You know, I'm considering, you know, a care home, or I'm considering in-home care since my back pain is more difficult every day, or that I'm considering a care home since he's up all night long and I can't do this day in and day out. And I get an opportunity to say, I could use some help with this, right? What are some ways that would be helpful? How can people contribute? It could be time, it could be energy, it could be financial support. It could also be just a weekly phone call of checking in and asking about how the person's doing, but also maybe asking about how you're doing, because it's really important to find that balance. And of course, finally, if you're the primary caregiver and you've made your decision, there's some prompts as far as how to communicate that. I've decided to take the next step. You know, since, you know, the steps that I've taken towards preventing wandering are not working. You know, I've called the fire department 5 times in the past 2 weeks due to falls. Again, giving those tangible reasons help make it not so personal, but those facts of, you know, this is why I'm looking at this. And then, of course, asking for some support because it is a difficult decision.
And I think too, Stephanie, that last bullet point, I appreciate your support with this difficult decision. It's something we all need to etch in our mind when we're going through this caregiving journey. I've used that so many times personally, and have told that phrase to many caregivers. You know, be ahead of the game when you know, start your conversation out that way. So the family members will already be thinking, you know, they're supporting you. I think sometimes the most adversarial family members could be those that are not aware or not involved. And so, you know, if they're not in your shoes, if they're not participating in caregiving, they're not going to know how difficult it is. And that's the best way to get them informed. Have them come over and stay for a week at the house and walk in your shoes if you can. That'll kind of give a whole new awareness of what's happening. But really understand, I appreciate your support with this difficult decision, whether it be bringing help in the home, placement, out of the home. You need support. You're the one in the middle. You're the one that's doing all the work. So I will transition at this point, and Stephanie, you chime in if you have anything to share. But our words for you as attendees and caregivers: don't wait for a crisis, even during our pandemic. Ask yourself and be honest with yourself, how much longer can I do this? Explore care homes and options in advance. Dealing with cognitive and physical decline and coordinating all these pieces of the puzzle at the same time can be overwhelming and paralyzing, actually. How do you even get started? How do you get a break to do your research? And emotions are high. That increases, as we talked about, when things have to change. That's when you tend to see family dynamics maybe heat up a bit, and trying to keep everybody on the same page can be a little challenging. Everybody sees through different eyes. Making rush decisions doesn't always yield the most appropriate results or outcome. So just even the education you're gathering, even if your options aren't dialed in, but just being informed ahead of time and understanding the senior care world and a little bit as to how to navigate that is what we feel is very, very valuable. If you don't think forward and plan and gather information, you're going to have limited time and less professional guidance and support when you most need it. So get those relationships formed ahead of time. So when you're needing that help, even more so, you'll know who to turn to. Strategies for success. Some of this is a little redundant because we've kind of tapped into some of it, but gathering information, looking at your plan, and taking action. And I'll tell you, Stefani mentioned your line in the sand as a caregiver, what you can and can't do. That line changes for many of us. You'll have a good day and the line will extend out further, and then the next 2 days are just so stressful, you're hitting the wall. So be honest with yourself, know what your plan is, and be honest with yourself and your family, whoever your support team is, and who's on your team. As Stefani, we can't do this alone. If you are alone, you have a lot of professional resources that can assist you. If you have family members, let's look at jobs for each of them. Let's look at maybe one of them will be responsible for paperwork. The other one will be for a Medi-Cal application. The other one for looking at into options and doing virtual tours to kind of start the process. A big piece of this journey is how you handle your loved one that you're actually transitioning into care. The way we communicate with our loved ones has changed. So you would not sit down and talk to somebody with a dementia diagnosis that's well into the disease process and just be direct about everything, because you are going to have your hands full. You're going to have somebody that's agitated and scared. So do your homework behind the scenes and get all your details together, and then we'll strategize on how you transition and talk to your loved one when the time is right. In the planning phase, you aren't necessarily including your loved one who has a dementia diagnosis. As much as we want to, it usually backfires on you. Be prepared to be a partner in care with realistic expectations. You're going to hear me talk about this because I believe people who make that effort to be a partner with those they're handing their loved one over into a care setting have much more success. Those who go into it saying nobody can do this like I do and are not happy with everything along the way, they don't have very much success. And it's much harder on them as far as adapting to the transition themselves, because you're transitioning just like your loved one. So be gentle and remember to breathe. It's a difficult process. We try to make it as easy on you as possible, and you will get through it. And so will your loved one. So, when you start out your search, I included this slide, and these numbers the large residential care facilities for the elderly, RCFE, is the coined name by the state for assisted living, memory care, board and care. The large settings in Sacramento County alone, we have 62 plus, because there's several being built right now. Small residential care facilities, which are typically, most of them are board and cares that are licensed for 6 individuals. Every day right now, we are getting calls from newly licensed facilities. So this number is growing leaps and bounds. So it likely won't be an accurate number tomorrow. So skilled nursing facilities, or what we call rehab centers now, they're wellness centers, rehab centers. They used to be called convalescent homes. We had one new facility built this last year. In 2019, it opened, and that's the first one we've had opened in many, many years. So this number is not growing like the assisted living world or the residential care facility world is. So, I mean, this is a glimpse of just Sacramento County, and more reason to how do you mull through all these properties to try to figure out what's going to be the best one for your loved one. So the pros and cons to consider. So we want to bring this up because nothing's perfect. And the pros of looking at a care setting out of the home is, rather than managing care in your home, you instantly have care and services available 24/7. It's more affordable than hiring in-home care services. In-home care right now is averaging $30 to $32 an hour, and a daily rate, and I wrote that down for you so you could kind of have an idea. If you're going through an agency, a licensed home care agency, daily rates are in the range, likely the average range of $740 to $768 a day. So assisted living, you know, you're for one individual, you could be paying on the low end $3,000 a month up to, you know, $8,000, $9,000 a month. So you can see the cost is more affordable than trying to manage 24-hour care in the home. Opportunities for increased socialization and activities to stay engaged. Even during the pandemic, they are doing social distancing activities and bringing as much opportunity for socialization to individuals in care homes, whether it be large or small. Additional support for family caregiver and reduce stress. You know, you instantly have more support, and it takes time for you to feel like your stress is lifting. You know, as you go through the transition and you get used to what this feels like when you're not a 24/7 caregiver, you will have reduced stress as you learn to partner in care. The downside is obviously you're moving to the individual is moving to a much smaller space, whether it be an apartment style, assisted living or memory care or board and care, that where you have your own bedroom, or if finances don't allow a private room, you share a room with another individual. People don't think that works, but it does. You know, we as family members want our loved ones to have a large space, but we have to work with what we have financially to work with. So the downside is you're leaving behind familiar surroundings, home, family, neighbors. Everything's changing. But what we find also is a lot of times your world has gotten fairly small already. So you're not integrating with the neighbors like you used to, or your home, you're not using all your home. You've got the bedroom doors shut and you go from the bedroom to the kitchen. Everything's a little much more simple, and so you're already downsizing and not even realizing it. There's lifestyle changes. Obviously, you have to adapt to a new routine, and people, meeting new people, caregivers, just about everybody everything that you come into contact, you know, it's constantly changing. And, you know, in facilities, caregivers will come and go. That's not on, you know, that's normal. You'll have your favorite caregivers and you'll have others that aren't your favorite, but that's our world we live in anyway, when we choose friends and you know, get along with other people. Transitions may trigger distress. So sometimes people adapt easy and sometimes it takes a little longer. So some caregivers adapt easy and sometimes caregivers sometimes caregivers have a hard time also. So if you have a loved one that's transitioning to a care home that has dementia, that takes a little more strategizing. Some individuals who already have high anxiety may need to have a medication for their anxiety on hand as needed. If there's behaviors if there's challenges that the caregiver has experienced at home, that needs to be addressed as well. So I'm going to go to the next slide. Come on, there we go. So what types of senior care settings are there? So these settings are licensed by Department of Social Services. We have large assisted living and memory care communities. Most of our larger settings have a memory care setting carved out somewhere in the building. There are a few standalone just assisted living, catering to more independent and not as heavy care that they are providing. But for the most part, the majority of our communities being built have a section reserved for memory care if and when needed. It's apartment style assisted living. They specialize in activities and socialization with the congregate dining room. They typically will have a level of care fee structure or a point system that they determine what your care charges are going to be. And you would have a rent plus care charges. So if there's a married couple, you'd have rent plus care charges plus a second person fee. All of the large settings typically also have a one-time community fee as well, and that will vary and it may change from time to time with each community. In the large settings, you're going to have more space inside and outside of the apartment. The buildings are lovely and they have a lot of amenities, and it's your home, so you're free to use all the amenities, the library, the activity room, the movie theater, you know, all the things they put on for that active person that really enjoys that. And I guess I have to mention too, some people move to large assisted living and they're very private people. They don't integrate in activities and their only socialization might be at the dining room when they go to 2 or 3 meals a day, which is more socialization than someone would get at home by themselves. I know my mom only went to 2 meals and could not, because of her aphasia, integrate into activities. So she'd go to music and she'd go to 2 meals a day, and that was it. But I was pleased that she at least had that interaction. And also in the multi-level facilities like we're talking, they have secure environments in memory care. So what that means is they have delayed egress doors where, you know, the door will appear to be locked, but it isn't. It's on a timer. So it keeps them safe from wandering. It's not a perfect system, but it gives the caregivers time to get there and to redirect appropriately. That's just kind of an overview of large assisted living facilities and memory care communities. On the flip side, we have small board and care settings, which are nestled everywhere in our community. They typically don't have signs out front, so you might not know they're there. And as I mentioned before, they're typically licensed for 6 residents. There's some that have more than that, but typically there's 6. It feels very much like your home or my home that's been retrofitted and gone through all the licensing and licensed in a similar fashion by Department of Social Services. You tend to see less activities, even though it's a requirement. You have an activity calendar. The individuals in board and cares tend to need more eyes on, hands on, and are a more frail population. So they will offer activities, but it doesn't mean the individuals feel like doing the activities. So if I hear anything from the clients, they will say there's not enough going on, but it's very much what the individual would be doing in their own home, which might be getting up, having breakfast, reading the paper, might do a little exercise in the morning, maybe take a nap before lunch, have their lunch and take a nap in the afternoon, talk to friends on the phone, watch a little television. It's just a less active group overall, but can be very good for personal care as well. And they do provide dementia care in the board and care settings. You know, there are some that have a very good staff ratio with true awake shift caregiving at night. All of these settings are required to have 24/7 care for individuals that are considered residents living in these communities, regardless of small and large. So, and the staff ratio will change. Obviously, the better staff ratio you will find in some of the board and cares are going to be the more expensive board and cares. So there are many options, and the more reason for you to plan ahead. So skilled nursing facilities, convalescent homes, but our old terminology we used to use, Department of Healthcare Services monitors these settings. They're institutional medical settings, 24-hour nurses on staff, short-term rehabilitation services. If you break a hip, you have a stroke, you typically go from the hospital to a rehab, you know, short-term stay in a nursing home or skilled nursing facility. I still call it nursing home. And it's obviously a more frail population than you typically even see in a board and care or assisted living, because they may be having medical challenges and medical treatment and recovering from certain medical incidents. So who pays for these facilities? Well, in assisted living and board and care, you do, for the most part. People oftentimes have to sell their home, which may be their only asset. They don't want to leave their home. For the most part, everybody wants to stay home, but the reality, because of the cost of care, people have to look at options out of the home when it gets to, used to be after 8 hours of care in the home, that was the tipping point, but it's not the same anymore because the cost of care has gone up significantly. You will tap into your savings if you have taken out long-term care insurance. That can be very helpful, and you will have many more options to choose from. But I will take a second to talk about that right now. Is get your policy out ahead of time. Understand what it's going to cover. Know how to initiate a claim. Know what if you have an elimination period, you're going to be paying out of pocket during that 30, 60, 90 days, plus you paying for your premium. So understand all this. And I work with many people trying to understand what their policy is going to cover. And it can be quite helpful, and it can be quite daunting also to figure it out. But anyway, if you have it, use it when you can. Veterans benefits, aid and attendance are also available for those who served during time of war and will qualify financially, as well as Medi-Cal. Medi-Cal waiver program, the assisted living waiver program, is a wonderful program that has been in existence for quite some time now, and we're care coordinators for that program, helping individuals get the care they need, where their Social Security pays for the the room charges, and Medi-Cal picks up the care charges. There's a long wait, and if you're interested in this program, be sure to contact our office. SSI, I listed this, and I haven't had any success placing anybody into a care set strictly on SSI funds for quite some time. There may be one or two options that could possibly work while you're waiting for the Medi-Cal waiver program, but it's almost impossible in today's world. Skilled nursing facilities, private pay, individuals can private pay in the custodial wing, the long-term wing of the nursing home. Nursing homes are divided into two sections. You have the rehab wings, and then you have the long-term care wings, which we refer to as custodial beds, where people are actually living there for the remainder of their life. You can private pay. You can use your long-term care insurance here if your policy is written such. Medi-Cal also pays for long-term care, and also Medicare is involved in your short-term stay. The biggest myth when it comes to Medicare is when people get in for rehab, they think they have 100 days for their stay. The average stay after a fracture or a stroke is 2 to 3 weeks in a skilled nursing facility. The facility has to follow Medicare guidelines, and then you're discharged back home or to assisted living, and outpatient therapy begins. So it's a little bit of a shock to a lot of people who have not been in that, caught up in that rehab stay before, but just being aware that the minute you would go into a skilled nursing facility on a Medicare stay for rehabilitation, you need to be planning for your discharge, start it right away, because it's going to come up sooner than you expect. So choosing the facility. I always think it's important to work with a reputable placement and referral agent. Do your due diligence, ask around, call your senior service agencies, and find out who does well and who does what and who does it well. You don't need to get caught up with individuals that aren't in that category. What are your priorities? I don't think location should be number one, but oftentimes it is. What's more important is the best fit for your loved one. If it's close to you and it's not the best fit, it's going to be a nightmare. The cost is huge. You know, we obviously are working with a certain budget, so that's going to be part of the criteria that we use and that you use when you're looking at what you can afford. If you have a financial advisor, what I suggest you do is come to us, talk to us about the care needs, what the options are going to potentially cost. Then go to your financial advisor and say, this is what I'm looking at. How long can I afford this? In married couples, we need to make sure we have enough money for both parties. So, you know, getting some financial advice, if you have someone you trust, is really beneficial. What are the services being provided in the facilities? You know, what's important to you? What is the safety measures in place to keep your loved one safe if the person has dementia? Excuse me. Are you able to afford private versus shared rooms? Studio versus 1 bedrooms or 2 bedrooms? You know, what are you looking for? Is nursing staff on site, and is it needed? You know, is your loved one a diabetic? Is there blood sugars and insulin injections needed? That complicates things a bit, so we need to make sure that you have the support you need. Experience, staff training, that's important to know. You know, what the state requires, a certain amount of staff training, and what is it you're looking for? What type of care does your loved one need, and are they equipped to provide it? The dining programs, that's more specific, the dining program, to larger settings where they have congregate dining. Many of the settings now are anytime dining, where you can have an omelet at 1 in the afternoon if you're sleeping in, or if you, what I tend to see is most of the people still go at 8, 12, and 5, or even 4:30. But there's some stragglers in between, and you have that option. You can have meals delivered for an additional fee to your apartment as well. The dining programs may also include or should include special diets, diabetic, soft pureed foods, this sort of thing. If you have a special diet, you need to make sure that the facility you're choosing or looking at can manage that special diet. The small settings can manage the diet a little closer. So if there's a real specific need, it's sometimes met better in a small setting. And I'll give you an example. I have a Parkinson patient whose meal times are coordinated specifically with medication administration, and it's down to just a few minutes, and he's very unstable if it's not met. And so in the small setting, they have a calendar, and he's a huge fall risk also, so we've got a lot of help surrounding him, but it's critical to the family and to this resident that everything is dialed in to the minute almost, and he does much better because of it. So let's talk about COVID-19 protocols. Assisted living, board and care, and memory care. So we have seen so many changes in the last six months. And people will say, are they open? Are they accepting residents? What does that look like? What does visitation look like? Yes, they're open. Initially, it was kind of tenuous. There were a few facilities that just closed entirely till we knew more about the virus and what the health agencies were suggesting. But the basic testing requirements, if you're going into assisted living, board and care, memory care, the recommendations are that you have a negative COVID test within 72 hours of admission. That's a little tricky, so you have to make sure you get your resources, have your resources at hand so you know where you can get this done. Some of the testing are drive-through, some are ordered and done at a lab. You know, it's just all very different. And some of the facilities that once you're admitted, you do a quarantine period, and I've heard 2 weeks from several settings. I've heard other settings, once you're admitted as a resident into assisted living or the board and care and you've had a negative test, some of the larger settings will retest upon admission, and you only have to isolate for a couple days until they get the results back. So it's a little different. They're all following the healthcare agency's guidelines, but it just being aware of that, going into it, that getting that negative COVID test is part of your planning phase and part of what you need to get. What does the visitation look like? So if the facility is COVID-free, they're likely offering maybe scheduled visitation, outside visits with appropriate social distancing and masks. If the facility has had an outbreak, a staff member coming to work that's testing positive, and I'll bring that up because every 2 weeks the facilities are required to test 10% of their staff, and they rotate through and keep that testing going. If somebody does test positive or a resident tests positive, there's an isolation for those individuals, and likely there's going to be some tightening of the visitation restrictions until it's cleared again within a couple weeks when they test again. So it's kind of a moving target as far as what visitation looks like. If your loved one's on hospice, there's a little more flexibility there, and that also varies amongst facilities. So again, be aware that the negative COVID test is going to be needed. The facilities are retesting on a regular basis every 2 weeks. Their staff and watching for symptoms every day, taking temperatures. They're working so hard to keep this virus controlled. And for the most part, they're doing a very good job when you look at the number of seniors in care settings. Skilled nursing facilities. I talked to a few different skilled nursing facilities, and the patients coming in oftentimes are tested. If they're coming from a hospital, they've likely already had a test, but they have to be tested, I believe I was told, within 7 days of admission. If they're positive, they are going to be going into an isolation wing, most likely, and then retested. I've also heard they don't retest for 90 days. Whereas most people are not in the skilled nursing facility for 90 days. So it's a little tricky. The visitation is much more limited in skilled nursing facilities because the population is much more frail and unlikely coming from the hospital settings. So I'm hearing most families doing window visits when they can, if it's accessible, and iPads, FaceTime, these kind of things to try to stay connected with their loved ones. It's just a very difficult time for everybody, especially in the hospital and skilled nursing facilities, I believe. Stephanie, do you have anything to add to that? Did I miss anything that you're aware of? Are you hearing from your families that you're working with?
I think just keeping in mind that communication. You know, I think one of the tools that one of my clients shared with me is she kind of found her go-to person on the inside, is how she referred to it. You know, and having someone that can maybe stay in communication to maintain that reassurance about how their loved ones are doing, and then definitely accessing visitation via the window or through different types of devices for the video chats. But yeah, I agree. It's a really difficult time, and it weighs on everybody's hearts, not just the families, but also the persons working inside the care homes too.
Right.
Yeah, right. And everybody's doing the best they can.
Yeah, and what I've heard from individuals who are family members who have placed their loved ones in memory care, window visits can be tricky because they don't understand why you're standing out there. They might not recognize you through a window or recognize you at all, so they don't feel like maybe the window visits are very effective, but it's a way for you to keep in touch and see them and make sure everything's going okay also. So let me move to the next slide. Okay. And I just got a warning that I'm running out of time, so I better pick up the pace here. The checklist prior to move-in: tour facilities, check licensing records prior to decision. And I will tell you that facilities, when you're touring them, sometimes now they're doing virtual tours, or FaceTime tours, or limited tours within the building or perimeter of the building. So they are, you can access facilities one way or another. Licensing will have their records, and it's a website that you can go to check. We try to stay abreast of those also. You have to know what citations are in place prior to moving your loved one in. Select appropriate options and leave deposit, and begin to coordinate your move when you're ready to make that decision. If you don't leave a deposit, especially if you have a specific type of room or in a board and care where they only have one opening, you're likely to lose that opening. You're going to need a physician's report, which I'll show you a picture of in the next slide. And that's filled out by your primary care doctor. Signed medication orders, a current TB test or chest x-ray. If you test positive and you're a carrier for TB, you'll need clearance with a chest x-ray. Many people who have done an ER visit recently will have a chest x-ray that will suffice. And of course, in bold print, you need a negative COVID test within 72 hours of move-in. And then you will have a good sized facility admissions packet to fill out. and that's something you could take home and work on. But you know, again, these are things you can expect to have to handle during your planning phase. This is what the physician's report looks like. It's several pages. It's filled out by the primary care doctor, and it's required by every facility that's licensed by Department of Social Services in our state. So what does move-in day look like? You know, anticipation of having to make this move is so stressful and sometimes paralyzing for people. Just keep one foot in front of the other. You've got your plan in place. You know, who's helping you, who's doing the move, who's going to take your loved one out of the home while you're gathering the items, who's going to set up the room or the apartment, and what does that look like? Has that changed during COVID? What's the move-in process that works and keeps people COVID-free? You know, so even the movers and the family members setting up rooms are under a little different microscope now also. Know who your go-to people. When Stephanie said communicate, moving day is huge. I always believe early in the week, early in the day. Then you have your full-time staff. If you have part-timers on the weekend, then you just have a better flow, I believe, instead of a weekend move-in, which sometimes is the only way that working people can get it done, and it does work. Sometimes it'll just be a little more challenging. And just understand what your COVID protocol is, who your contacts are in the facility. What are you telling your loved one for move-in, for the move-in day? Are you going on a vacation and they have to stay here? Are you having some health issues and you need more help? What is your story? It has to be consistent. Talk to the staff in the facility that's assisting you with the move-in, and what works for them. What do they see work most successful, especially, you know, when the residents are cognitively impaired and don't understand why the move is taking place for the most part. You're on move-in day, you're starting to cross that bridge into placement. And once you get over the bridge, then you will start to adjust and transition yourself. Identify who your contacts are, like I said, and maintain good communication. Realistic expectations about the transition, knowing that it's going to take time for them to get to know your loved one. It's a dance you do together. So just as it took you time to adjust to different roles in caregiving, it will take them time also. Some individuals adjust overnight, some take months. It seems like the 3-month mark is the magic bullet as far as when people are settled in. And of course, that's different for everybody. And I typically, when I give this workshop, I talk about being a hovercraft. Right now during the pandemic, it's hard to be a hovercraft because you can't be there all the time. But if the pandemic were to go away tomorrow, and don't we wish it all would, there are family members that are there all day long and in good intentions, but what happens, the individuals typically take longer to adjust. They need to rely on the care staff and learn to rely on somebody besides you to do things. So when I say don't be a hovercraft, you know, give the facility space to know your loved one, to care for your loved one, and support them and be supportive. And keep your priorities in order. Are the socks missing, or are there medication errors? You know, so what's important? And what causes placements to fail? Someone's having some unexpected medical situation that the facility can't handle. That's out of everyone's hands. But more importantly, a family that does not know how to partner and has unrealistic expectations, they may not succeed with placement. So I always tell folks, you know, have realistic expectations. You're being a partner in care. We want you to succeed. That doesn't mean you won't have complaints. That doesn't mean you're not going to communicate with the facility and problem solve. You know, it just means you don't want to be that person that they hide from when you walk in the door. You want to be a partner if you can feel comfortable doing so, and you choose a setting that you feel comfortable partnering with. So as we start to wrap up and open up for questions, in summary, revisit your care plan on a regular basis and be honest with yourself. Because what you thought your care plan looked like 6 months ago or a year ago may be very different what it looks like right now. Do you have health issues you didn't have a year ago? You know what? Be honest with yourself and make changes in your care plan and be proactive. You know, start to gather that information and start planning. Don't wait for the crisis. We deal with crisis every day, 7 days a week, sometimes 24 hours a day. The need for care does not take breaks in the midst of a pandemic. So I think people are holding off as long as they can, and then we've been seeing more crisis situations because of it. And I understand that. I understand the fear people have, but people still need care regardless. Have realistic expectations as I close, and being a partner in care. And I put that last so that maybe that sticks in your mind as you move forward with this. As hard as it is, those are two critical points in your success as you look into transitioning your loved one into a care setting. Okay, so let me move to the next slide. And I think we are opening up questions at this point. We hope you enjoyed our presentation today. So if you have any questions or insight, please put it in the chat room. And Simone from Del Oro is going to be sending those to us to help answer questions for you. And if we don't have any questions, we will wrap up soon. But Stephanie, did you have something to say?
I was going to add one other thing while we're waiting for those questions to come in, is to really think about who's on your support team. And if you're needing some additional support, you know, with Del Oro Caregiver Resource Center, we're one of 11 resource centers in the state of California. And there's a family consultant that you can add to your team. You know, we oftentimes have the medical team, family members, neighbors, friends, support groups, but your family consultant can walk with you through the caregiving journey. We navigate the changes step by step. We follow up every 6 months. We receive funding to help with respite, in-home care, adult daycare. We help talk about, you know, your concerns, the challenges you're going through, and exploring, you know, what is coming up. Because oftentimes, no matter what step it is that you're looking at taking, it's the disease or the care needs that are determining that. It's not necessarily maybe your decision, but it's just, it's what happens. And so having a family consultant on your team can help you look at that and really acknowledge and honor that you are doing your best and that there are resources out there where you don't have to do it alone.
Great. We've had some questions come in, and the first one is, what are solutions for helping a dementia patient adjust to a new setting? Well, that's going to be different for everybody. And like I said in my presentation, some adjust well. I think the solution, as a caregiver placing a loved one into a care setting, what you can do ahead of time is really familiarize the staff, write out what their likes and dislikes are. So they have a go-to sheet and they understand, and many times in the admissions packet, that will also be part of the questions you have to answer. But they want to know how to redirect, what activities your loved ones like, you know, what does that look like for them? They're going to be so involved and adjusting to their new environment and new faces. So solutions for helping a dementia patient adjust is just to understand the person more. What are their triggers? What do they like? What do they dislike? What are their favorite foods? What's their favorite music? What do you do at home that works? That, to me, works the best. You know, many times the settings will ask you to stay away for a couple weeks, a few days. It's very different for everybody. so they can get to know your loved one. And it's not to alienate you, it's to help with the adjustment phase. And what do facilities do to help them adjust? You know, some of what I told you, sometimes they will have, assign them to a specific table to eat, or next to a specific resident that's already living there that maybe they think they will be compatible with. Maybe they will be having the activity director go get them and engage them in specific activities. You know, I really believe they try their hardest, and they want this to succeed very hard. So we really can't predict how it's going to go, but there's things you can do to put into place. You know, what works for your loved one at home, what challenges they need to know. If you've had challenges, if your loved one's been aggressive and mean, they need to know that so they can be ahead of the curve in dealing with that. And are there anti-anxiety medications that doctors prescribe to help with transition? Yes, there are. And that would be either through your primary care doctor or your neurologist. And I'm not going to make any recommendations because it's all very individual, and you treat the person as a whole, depending on what other medications are being given also. And I know that, you know, doctors are very cautious about prescribing psychotropic medications, and they want to do it very carefully, low doses. So yes, talk to your doctor and let them know you're making a transition, and you know, you anticipate it's going to be a difficult transition, and what can they prescribe to help if needed. Some people have to be on those medications on a regular basis. And so another question I see, are there services that can help the caregiver and family to downsize the care receiver's home? And Stephanie, you chime in if I'm missing anything, because I'm just reading through these. Yes, there are. There are downsizing services that will charge you by the hour. They'll come out and they will give you a quote on what it would cost to pack up your home, to move and set up the new apartment. And that can be extremely helpful. We've used these services for clients, and I've used it personally for my mom a few different times, and it was very, very helpful. So I strongly suggest you get your help doing that, because when you start packing up a home for a move, that's another thing that can be paralyzing. Is there a place to look to find a list of different types of senior care settings in your area? And that's what we're here for. So I'm hoping you would turn to Senior Care Solutions for that. If you live out of our 5-county service area, which is El Dorado, Sacramento, Yolo, Nevada, and Placer counties, if you live out of that service area, we have care partners out of the area that are reputable folks we can also refer you to. You can go on the state licensing website, but it doesn't tell you anything. You don't know what you're looking at as far as, you know, what the services are being provided, what their reputation's like, you know, that sort of thing. So yeah, that's what our agency does. So we welcome your call if you're interested. And when should someone start paying into long-term care insurance? That's a big question, because it just depends on your portfolio. Not everybody needs long-term care insurance. You know, so that's an individual question that you should maybe talk to your financial person about, or if you don't have one, find a trustworthy financial person to talk to. There's different vehicles to use besides long-term care insurance. My husband and I purchased it when we were 55, because obviously we work in this industry where most people can't afford what they want. So we wanted to have a little extra cushion. But, you know, and I'm seeing more and more people have long-term care insurance. Do you see that, Stephanie? Are you seeing more of your clients have long-term care insurance than they used to be?
No, not necessarily.
No?
I think it's, yeah, it just varies person to person. But I think more people are thinking about it and considering it, the investment.
Okay.
Yeah, it's hard when we don't have a crystal ball, right?
No, not at all. Exactly. So I don't see any more questions coming in. If you have one, this is your last, time to get it in. I am going to let you know that there is an evaluation at the end of the presentation on the chat room. If you guys and your participants would take time to fill it out, it helps us learn and do a better job each time we present. I'll just take a minute to tell you a little bit about Senior Care Solutions. I started that company 23 years ago. We're an agency, a large agency that specializes in resources in the home and out of the home. We don't hire caregivers, but we interview home care companies and help you understand that process, and also are very connected with most all of the facilities in our 5-county service area. I'm very, very proud of the staff that we have. We have 10 on staff. We have nurses that are working in the assisted living waiver program. We have social workers and geriatric care managers that help guide families through the senior care maze. There's so many facilities to pick from. If you get the help you need out the gate, you will narrow down your options and understand the process. And I hope you learned a lot of that through this presentation today. Stephanie, can you tell us a little bit about Del Oro's? You already tapped into some of it. What other resources that are available through Del Oro?
Well, as I mentioned, thanks, Carol. Del Oro is a nonprofit resource center for the family caregiver. So we focus on the person needing the care and the changes that they're going through, but also supporting the family caregiver. We do that with care planning, emotional support, respite funding, legal consultations, caregiver counseling, and looking at what are the resources in the community, and that we can take it step by step. There's never any pressure to move forward, but I think it's always helpful to have someone that's maybe not family or personally invested, but someone that cares about you, to ask, how are you doing and how can I best support you? And that's what we're here for. And it's not just a one-time phone call. We walk with you along the journey because it can be a bumpy road. And I think just that final thought that, folks don't have to go through this journey alone. And that's what you and I are here for. Thanks, Carol.
Well, thank you to Del Oro, the Alzheimer's Association, and we appreciate you being here today, and we will continue to bring education to our caregivers in the community as long as you want it. And we learn from these sessions ourselves, and we hope to get better each time we present. And if you're interested, we will have an October event where it's going to be interactive. So we're going to learn from that too, right, Stephanie?
Indeed.
So anyway,
we're all learning on this journey. As I say, there are no experts. We're all learning together.